Are you struggling to conceive and your doctor suggested tests like HSG or laparoscopy? You might be wondering, what's the difference? Which one is better? And which should you go for first? In this video, we'll break down everything you need to know about hysterosalpingography, HSG, and laparoscopy, their purpose, procedure, benefits, risks, and how they help in understanding infertility. When a couple has difficulty conceiving, doctors need to check whether the fallopian tubes are open, the uterus is normal, and there are no hidden problems like endometriosis or fibroids. Two common tests used to evaluate this are hysterosalpingography, HSG, and X-ray dye test for checking fallopian tube blockage. Diagnostic laparoscopy, a minimally invasive surgery that gives a direct look inside the pelvis. HSG stands for hysterosalpingography. It is a simple outpatient procedure that uses X-rays and a contrast dye to check if your fallopian tubes are open and if your uterine cavity has any abnormality. How it's done. It's usually performed after your period ends but before ovulation around day 7 to 10 of your cycle. A thin tube is inserted through your cervix. A dye is gently injected into your uterus. X-ray images are taken as the dye flows through the tubes. If the dye passes freely, your tubes are open. If it stops midway, that suggests a blockage. The procedure takes only 5 to 10 minutes and may cause mild cramping or discomfort, similar to period pain. Let's look at the advantages and limitations. Pros: simple and non-surgical. Quick, done in minutes. No anesthesia required, helps visualize uterus and tube openings, can sometimes clear minor blockages during the test. Cons: only shows the outline, not internal problems like adhesions or endometriosis, mild pain or allergic reaction to dye in rare cases. Doesn't treat any detected issue, only diagnoses it. Laparoscopy is a minimally invasive surgical procedure that allows doctors to look directly inside your pelvic organs, uterus, fallopian tubes, ovaries, and surrounding areas. How it's done. It's performed under general anesthesia. A small incision is made near your belly button. Carbon dioxide gas is used to gently inflate your abdomen for visibility. A thin camera, laparoscope, is inserted. Sometimes additional small cuts are made for instruments. Doctors can diagnose and treat problems in the same procedure, such as removing cysts or fibroids, clearing blocked tubes, treating endometriosis, breaking adhesions or scar tissue. Pros: gives direct visualization of internal organs, can diagnose and treat in one go, detects issues that HSG can miss, like endometriosis or adhesions, can improve fertility by removing blockages or lesions. Cons: requires anesthesia and operating room, involves small surgical cuts and short recovery time. Slight risk of infection, bleeding, or organ injury, very rare. More expensive than HSG. First, HSG, or hysterosalpingography. It's a quick X-ray test that checks whether your fallopian tubes are open and if your uterus shape is normal. It takes only about 5 to 10 minutes, doesn't need anesthesia, and you can go home the same day. You might feel mild cramping, similar to period pain, but it's short and simple. However, HSG only shows if there's a blockage. It cannot treat the problem. Now, laparoscopy is a bit different. It's a minor surgical procedure done under anesthesia. Doctors make a small cut near your belly button and insert a camera to see your uterus, tubes, and ovaries directly. The best part? If they find issues like endometriosis, cysts, or adhesions, they can treat them on the spot. It takes around 30 to 60 minutes, and recovery usually takes 2 to 3 days. In short, HSG is quick, simple, and shows the problem. Laparoscopy takes longer but can actually fix it. Most fertility specialists recommend starting with HSG because it's simple and non-invasive. If HSG shows a blockage, or if your doctor suspects endometriosis or pelvic adhesions, then laparoscopy is the next logical step. In some cases, especially when multiple fertility factors are suspected, doctors might directly go for laparoscopy to diagnose and treat in a single procedure. Both HSG and laparoscopy are valuable tools in understanding fertility problems. HSG helps detect possible blockages quickly, while laparoscopy helps find and fix deeper causes.
If you've been trying to conceive for more than a year, talk to your gynecologist or fertility specialist.
Remember, early diagnosis can save time, stress, and improve your chances of a successful pregnancy.
If you found this video helpful, hit the like button.
Subscribe to our channel for more women's health insights, and share this with anyone going through fertility testing. Stay informed, stay hopeful, because knowledge is the first step toward motherhood.